Here's what you should consider while opting for orthopedic residency. This is just to give you a context so you can decide if this branch is for you or not. So, orthopedics is not a terminal branch. Many people think 3 years of PG and you are done. You are an orthopedic surgeon. But the truth is, in many colleges, you spend those 3 years without even touching a patient. You come out with a degree, but no surgical confidence. Even in good colleges, residency alone is rarely enough to make you independent as a surgeon. Whether you learn properly doesn't depend on the name of the college or where your college is. It depends on your HOD, your unit, your department, your seniors, the number of residents you have, and finally, your own capacity. It does not depend upon if the medical college is government or private. That's why fellowships exist, because orthopedic itself is a big tree, and every surgeon ends up picking a branch like arthroplasty, arthroscopy, spine, pediatrics, foot and ankle, hand surgery, trauma. Let's talk about few. Arthroscopy, that is the ligament surgeries using an arthroscope. It is one of the toughest. The system itself costs around 15 to 20 lakh rupees. You can watch 1,000 cases of arthroscopy, but until you hold the scope in your own hands and learn the triangulation in that underwater world, it makes no sense. Nobody holds your hands and teaches you. Only after 20 to 25 such cases, you can even start to get oriented. And that's why it has one of the longest learning curves in orthopedic surgery. Then there is arthroplasty, that is joint replacement surgery. So there are two routes, one is conventional and one is robotic. So conventional joint replacement is an open approach, easier to learn, and many centers give you a hands-on exposure. But now robotics has come in, and the public perception is robotic means modern, better, safer, which pushes young surgeons into robotic fellowships. But here's the reality, one robot costs around 4 or 5 crores. So even if you are trained, which hospital will hand it over to you? Like, which hospital will give their robot to you when senior surgeons are already waiting in the line? And if you really want to specialize deeply in arthroplasty, sometimes people also go for MCH, which is again a super specialization, which again will take your 2 or 3 years. Spine. So spine follows the same story. Conventional spine surgery can be learned with fellowships, but it needs years of focus. Again, robotic spine surgery also exists, and it is the same thing, just with a robot. But again, nobody gives you access to the machine, and just like arthroplasty, MCH in spine surgery is becoming the standard for those who want to establish themselves properly. And then there is pediatric orthopedics, foot and ankle, hand surgery, trauma, each with their own fellowships and their own struggles. So do the maths. Orthopedics is not a terminal branch. You don't stop after PG. You pick a specialty and then you will spend another 2 or 3 years in it. That's almost 3 plus 3, so that is 6. So if you want to practice more, refine more, give more, that's on you. But just remember, the branch doesn't end with a degree, with a post graduation. And if you thought residency was tough and fellowship would settle things, wait. Wait till you see the real struggle of practicing after fellowships.